The purpose of this video is to explain why a patient would need a panoramic radiograph. A panoramic image is very important because it allows a dental professional to view a large area of the maxilla and the mandible. This image is often used to supplement bite wings and periapical images. It is typically used to evaluate impacted teeth, eruption patterns, growth and development, to detect diseases, lesions, and conditions of the jaws, and to examine the extent of large lesions and to evaluate trauma. In the first case study, a 20-year-old female with trauma to the head and neck area sought the dentist because of pain in her lower jaw. Upon clinical evaluation, the dental professional determined that a panoramic radiograph would be the best option to show possible fractures related to her injury.
I heard you had a really bad ski accident. I hope everything's okay. So we just want to make sure that there's no fracture or trauma to the jaw, the mandible area. So a good way to detect that would be to take a panoramic x-ray, and it's very simple. It will take about 45 seconds, and we'll be able to see the upper and lower jaws for any fractures or problems with that area. Is that okay?
The clinician instructs the patient to stand as tall as possible with a straight back and to bite on the plastic block. The ala tragus and mid-sagittal plane is properly aligned, and further instruction is given to the patient. Case study, a 13-year-old female presents with crowded teeth on both maxillary and mandibular area. Upon clinical evaluation, the dental professional takes a panoramic radiograph to evaluate the malocclusion for eruption patterns, growth, and development.
Hi Karina, during your assessment I noticed that you had some crowding in your mouth, and I just wanted to take a panoramic x-ray which is going to show your jaw and the surrounding structures, just so I can see that your adult teeth are going to be erupting properly and that you have enough space for all your teeth.
In the third and last case study, a 18-year-old female complains of tenderness and swelling around the tissues next to her second molars.
So Kylie, what brings you in today?
I've noticed that there's an area in the back of my mouth that I feel like there's like a tooth maybe, and it's covered by some of my gums, and when I brush it it's hard to get in between.
Okay.
I wasn't sure if...
Does it feel like there's some gum tissue covering that tooth and it's way in the back, the very last one there?
Yeah, right over here.
Okay, what you're talking about is commonly known as a wisdom tooth. Have you heard of that?
Yeah.
And really the technical name is a third molar. Some people have all four of them erupt, because you do have four of them in your mouth. In most cases, but sometimes you don't, and the best way to see, if you have them, if they're going to come in, if there's space for them, because sometimes there's not space, so we're going to take a panoramic x-ray, and that's going to show us...
Space, do they have to pull?
Well, this panoramic x-ray will show us if you're going to need to have them extracted or not, if they're going to cause any trouble, in the future for you, so I'll suggest that we get one taken, and we can go from there.
Okay.
Lastly, a panoramic radiograph will allow the clinician to detect diseases, lesions, and conditions of the jaws, such as The purpose of this video is to explain why a patient would need a panoramic radiograph. What happened?
Enough space for your permanent teeth to develop and erupt, and I just want to diagnose teeth. I noticed that you had some crowding in your teeth. Oh. So, what brings you in today?
Well, I seem like you're really dumb about it. You're not in the dental field.
Yeah.
Tell me about
Go.
So Kylie, what brings you in today?
I've noticed that there's...
We can go from there.
Okay.